All right, today we are going to dive into something called diabetic ketoacidosis, or DKA for short. Now, this is a serious metabolic crisis that can happen with diabetes, but trust me, it's way more than just having high blood sugar. We're going to break down exactly what it is, why it happens, and how this emergency is actually turned around. So, let me start with a question that might sound a little weird. Have you ever heard that one of the signs of a major diabetic crisis is breath that smells fruity? I know, it sounds bizarre, right? But it's actually a critical clue that the body is in a state of absolute metabolic chaos. And we're about to find out exactly why that is. So when this crisis kicks in, the signs are anything but subtle. We're talking about really intense stomach pain, vomiting, and a very, very specific kind of breathing. These deep, rapid gasps. They're actually called Kussmaul respirations. It's the body's desperate, all-out attempt to fix what's going wrong on the inside. And yep, there it is, that acetone or fruity smell on the breath. These aren't just little hints, they're alarm bells, signaling that something is dangerously, dangerously off. Okay, so let's get right to the heart of it. What is actually happening inside the body during this pretty terrifying metabolic emergency? DKA is basically defined by a perfect storm of three major problems happening all at once. First, you've got hyperglycemia, which means your blood sugar is sky high. Second, you have acidosis, where the blood itself is literally becoming acidic. And third, ketonemia, which is just a flood of these acidic compounds called ketones washing through your system. When you have all three of those things together, you're in a full-blown crisis. So, how does this all get started? It's not just one thing that goes wrong. It's more like a cascade, a domino effect that sends the body's entire system into a total tailspin. And it all begins right here. A critical lack of insulin. You can think of insulin as the key that opens the door to our cells, letting sugar or glucose get inside to be used for energy. Well, when there isn't enough insulin, that key is missing. The body's cells are literally starving for fuel, even though there's tons of sugar locked just outside in the bloodstream. And this just perfectly shows that chain reaction. With no way to use sugar, the body panics. It flips the switch to its emergency backup plan, burning fat for fuel. But this is a messy, inefficient process. It creates these acidic leftovers called ketones. In DKA, the body goes into overdrive making ketones, way faster than it can get rid of them. And that's exactly what makes the blood turn acidic. So, with the body in this really dangerous state, how do doctors know for sure that DKA is what's going on? Well, it all comes down to specific, measurable numbers from the lab. The diagnosis gets locked in when all three parts of this DKA triad are officially met. D stands for diabetes or hyperglycemia, with a blood glucose over 200. K is for ketosis, which is confirmed by checking for high ketone levels in the blood or even just the urine. And A is for acidosis, where the blood's pH drops below 7.3. You gotta have all three for it to be a DKA diagnosis. To really understand what DKA is, it sometimes helps to look at what it isn't. There's another diabetic emergency called HHS. In HHS, the blood sugar is often way, way higher, but the absolute key difference is the ketones, or really the lack of them. Without that flood of ketones, the blood doesn't turn acidic like it does in DKA. It's a completely different kind of metabolic disaster. Okay, so once DKA is confirmed, the clock is absolutely ticking. The treatment has to be aggressive, it follows a strict protocol, and it focuses on three essential pillars to pull the body back from the brink. The whole strategy really boils down to three core actions, and they're all done at the same time to bring the body's chemistry back into balance as quickly as possible. First up, fluids, and I mean a lot of IV fluids. Patients are incredibly dehydrated, and this helps restore their blood pressure and circulation. Second, insulin. An insulin drip is started, and this is what finally shuts down that out-of-control, fat-burning furnace that's making all the ketones. And third, electrolytes. The crisis just flushes vital minerals out of the body, especially potassium, which has to be replaced very carefully to protect the heart. But hold on a second. Here's a really interesting and super important point. If this whole mess starts because there's not enough insulin, why in the world would a doctor ever wait to give it? I mean, that sounds like the very first thing you should do, right? It seems kind of crazy. Well, the reason is all about safety.
See, insulin doesn't just push sugar into cells, it also pushes potassium in there with it. So if a patient's potassium level's already low to begin with, giving insulin right away could cause it to plummet to a critically dangerous level, and that could risk a fatal heart rhythm problem. That's why doctors have to check and, if needed, fix the potassium level before they start the insulin. It's a life-saving pause.
So, we've seen the crisis and we've seen the fix. But the absolute best case scenario, of course, is to stop that first domino from ever falling. So, what is it that actually triggers DKA in the first place? Well, believe it or not, the most common trigger is actually an infection. Any illness puts stress on the body and makes it need more insulin. Other huge causes are things like missed insulin doses, or sometimes, and this is really tragic, DKA can be the very first sign that someone has type 1 diabetes and they didn't even know it yet. Even something like emotional stress can be a trigger. And this brings us to what might just be the most important takeaway from all of this. While DKA is absolutely a life-threatening emergency, for the most part, it is largely preventable. With education, with proper diabetes management, and knowing the right things to do on sick days, this whole crisis can often be avoided entirely. And so, this leaves us with one final thought. We've seen exactly how a simple lack of insulin can set off this catastrophic chain reaction in the body. The real key to preventing it is awareness. It's about recognizing those early warning signs, whether it's in yourself or in someone else, long before that first domino even begins to wobble. Understanding the why is really the first step to stopping it from ever happening.